Okay, so for today's deep dive, we've got a really interesting set of topics, all focused on India.
Yeah, it looks like we're going to be tackling sanitation and hygiene.
The fight against vector-borne diseases, which
Yeah.
is a big one.
Huge.
And then we're also going to look at training and deploying community health workers, which is obviously vital.
Absolutely.
And then, to top it all off, we're diving into the world of healthcare data, privacy, and security in India.
Oh, yeah. A lot of ground to cover, but it'll be fascinating, especially since they're all kind of connected. You think about
Oh,
it.
yeah, that's what I was thinking. You've got this physical infrastructure piece with sanitation and disease.
Right.
Then you've got the human element of the health workers.
Yeah.
And then you've got this digital layer with the data privacy.
It's like three different layers of the same, like, big picture. You know what I mean?
I do. And that's actually something that popped out to me right away when I was looking through all this. It seems like political and policy decisions have a huge impact on all three of these areas.
Oh, yeah.
It's like whether you're talking about preventing dengue or protecting health records.
It's true.
It's the political and policy stuff that seems to really determine how much progress gets made.
It's a major factor, that's for sure.
So I guess that kind of brings us to our first deep dive, which is all these interconnected public health challenges.
Right. Starting with sanitation, hygiene, and those vector-borne diseases.
Okay, so paint a picture for me.
Yeah.
What's the situation on the ground in India?
Well, the scale of the challenge is, well, it's big. You've got issues with infrastructure,
Oh.
big time. Like, open defecation is still a reality,
Wow.
for a lot of people. And waste disposal is often lacking. And even access to clean water is, well, it's not universal,
Right. And that obviously leads to a lot of those diseases, right?
Absolutely. It's a direct contributor to those high rates of malaria, dengue, chikungunya. Those are all hitting a significant chunk of the population every year.
And it's not just what we've already built or haven't built, is it? Climate change is adding another layer of complexity here.
Oh, yeah.
Like, think about how it's impacting, the spread of these diseases.
Right.
It can change where the mosquitoes live, how they breed, all of that.
Exactly. And on top of all that, we have to think about public awareness.
Yeah.
How much do people actually know about prevention?
Yeah. That's huge.
Especially in those more remote areas. And then you've got the challenge of actually monitoring these diseases effectively.
Right.
If you've got weak surveillance systems, well,
Yeah.
that means delays in response. And that could mean, bigger outbreaks.
And that makes it all the more difficult to contain, right?
Yeah, absolutely.
So it's like this cascade effect.
Exactly. And what's interesting to me? It's how similar the political challenges are across all these different areas. Whether it's the center and the states clashing over, like, nationwide sanitation standards,
Right.
or if it's the same thing, but this time it's slowing down a unified health data system.
Yeah. So it's almost like a systemic issue.
It suggests there's something going on with how the different levels of government coordinate. It's like built-in friction almost.
Right.
For example, we see some states getting way more funding for disease control than others.
Oh, wow.
So you've got these disparities in how things are implemented on the ground.
So it's like a postcode lottery almost, right?
In a way, yeah. And then, of course, you've got the bureaucracy, which can really slow things down.
Oh, yeah. You can have the best intentions, but
Yeah.
if you're stuck in red tape.
It's a nightmare. And it's not always about money or infrastructure either. Sometimes it's about the disconnect between urban and rural needs. Or maybe we're focusing too much on just building stuff instead of actually trying to change people's behaviors long term, which is so much harder.
Well, yeah. And I think people sometimes forget that this isn't just about, a few days of feeling sick.
Oh, no.
This has real economic and social consequences.
Absolutely.
We're talking increased healthcare costs, people not being able to work.
Right.
It even affects India's global image and tourism.
Oh, yeah.
It's a big deal.
It all adds up to a lower quality of life for a lot of people. It's not just a statistic, it's real lives.
It is. And so I guess that's where the community health workers come in, right?
Exactly. They're the ones on the front lines, often working in those communities that are hit hardest by this stuff.
Okay, so can you tell us a bit more about, like, who these people are and what they actually do?
Sure. So you've got these accredited social health activists, or AAs,
Okay.
and auxiliary nurse midwives, or ANMs. They're like the key frontline health workers. They handle all sorts of things like maternal and child health, preventing diseases like tuberculosis and malaria.
Wow.
They educate people about health, and they even provide emergency support in areas that are underserved.
So they're really like a lifeline.
They are. They're the bridge between the official healthcare system and the people who need it most.
Right, right. But, you know, it sounds like a really tough job.
Oh, it is. It's demanding.
And unfortunately, it looks like they face a ton of obstacles.
Yeah, that's the unfortunate part.
I mean, the information we have here paints a pretty bleak picture.
Yeah, it does. It talks about how the training they get might not be enough to handle everything they have to deal with.
Right.
And they're often overworked and underpaid. I mean, low pay and not enough incentives, that's a tough combination.
Yeah. It makes you wonder why anyone would even do this job.
It's true. It's a calling, that's for sure. And then you've got the lack of standardized guidelines. Like, every state does things a bit differently.
Right, so it's inconsistent.
Exactly. And that makes it harder for them to provide consistent care. And just like other public sector jobs, there often aren't many opportunities to move up.
So there's not a lot of room for growth.
Exactly. And that can lead to people leaving the job. And then, of course, we've got the political and bureaucratic delays again.
Those delays.
This time, it's impacting how they recruit and fund these essential workers.
So it's just another obstacle.
It is, yeah. And you know what? It creates this kind of vicious cycle.
How so?
Well, if you've got a community struggling with poor sanitation and lots of preventable diseases, that puts even more pressure on these health workers.
Oh, I see.
They've got more cases to manage, more complex health issues, and they're trying to educate people who are dealing with some really tough environmental problems.
So in a way, a lack of progress in one area undermines the work being done in another.
Exactly. They're all connected. You can't really fix one without the other.
Well, that brings us to the third piece of the puzzle, right?
Right. Healthcare data, privacy, and security.
You know, with everything going digital in Indian healthcare.
Oh, yeah, the electronic records, the telemedicine, it's a whole new world.
But it also introduces a whole new set of risks.
It does, particularly when it comes to protecting sensitive patient information.
So walk me through this. What are the big challenges here?
Well, one thing that really stands out is that India doesn't seem to have a comprehensive data protection law.
Really?
At least not one that's specific to healthcare. They do have the DPDP Act.
Okay.
But it doesn't quite cover all the bases. You know, it might not address things like how long health records should be kept.
Right.
Or what the rules are for sharing data during a public health emergency.
Yeah. Those are big considerations.
Huge. And then you've got the increasing cyber threats.
Oh.
You know, hackers targeting hospitals and stealing data.
That's scary.
It is. And then there's the problem of data being stored all over the place. You know, different hospitals and providers not always communicating securely. Plus, a lot of patients aren't even aware of what rights they have when it comes to their data.
Yeah, I can see how that would be a problem.
It is. And then, of course, there are gaps in the regulations, which means practices aren't consistent across the country.
So it's a bit of a Wild West situation.
Kind of, yeah. You know, and as if all that wasn't enough, we see those familiar political and policy hurdles popping up again.
Oh, no. Not those delays again.
Yep. Disputes between the states and the central government, different standards in the public and private sectors.
Makes things so much harder.
It does. Even the National Digital Health Mission, which is a great idea in theory, it's faced delays because of all the bureaucracy and lack of agreement.
So frustrating.
It is. And then, just like we saw before, the investment in cybersecurity is patchy.
Right. Some places prioritize it, some don't.
Exactly. It's not seen as a universal priority, which is a problem.
And this all ties back to our other deep dives, doesn't it?
Absolutely. If people don't trust that their health information is safe, they're less likely to get involved in digital health programs. Whether it's sharing data for disease surveillance or using telemedicine.
I see. So it erodes trust.
Exactly. And that lack of trust could even spill over to the community health workers.
Oh, right. If people think their data isn't being handled properly.
Exactly. So once again, it all comes back to this interconnectedness, this idea that you can't solve one problem without addressing the others.
Okay, so we've laid out the challenges. Now let's talk solutions.
Right. What can we do?
Looking across all three of these deep dives, are there any common themes that pop up in terms of how India can make progress?
There definitely are. And you're right, the need for more political collaboration is definitely a recurring theme.
Okay, so let's start with sanitation and vector-borne diseases.
Okay, so for sanitation, the sources we have are pretty clear. We need nationwide sanitation standards.
Right, something consistent across the whole country.
Exactly. A patchwork approach just doesn't cut it for something this important.
Makes sense.
We also need a serious investment in clean water and hygiene infrastructure.
Okay.
So that's non-negotiable. And, of course, we need strong disease control programs backed up by research and funding.
Right, so you're talking about the whole package, not just bits and pieces.
Absolutely. We also can't forget about public awareness campaigns.
Oh, yeah, that's crucial.
People need to know how to protect themselves and their communities.
Right, right. Education is key.
It really is. And finally, there needs to be better coordination between the health department and the urban development folks.
Interesting.
Because, as we've seen, sanitation and public health are inextricably linked.
They are. So what about the community health workers? What can be done to support them better?
Well, for starters, we need a standardized national training framework.
Right, so everyone's getting the same level of training.
Exactly. No matter where they are in the country, they need to have the skills and knowledge to do their jobs effectively.
Okay.
And then, let's be realistic, we have to pay them more.
Yeah, that seems pretty obvious.
It is. And we need better incentives, too. You can't expect people to dedicate themselves to this work if they're barely scraping by.
Right.
And then there's the career progression issue.
Yeah, we talked about that.
We need to create clear pathways for them to move up in their careers.
So they have something to work towards.
Exactly. That would help with retention and motivation. And, you guessed it, we need better coordination between the states and the center.
Here we go again.
It's a recurring theme for a reason. We need streamlined recruitment processes and efficient allocation of resources. And maybe it's time to start thinking about public-private partnerships.
Oh, interesting.
To bring in more resources and expertise for training these workers.
That could be a really valuable approach.
It could. Now, when it comes to healthcare data, privacy, and security, the big thing is creating a unified national framework.
Okay, so one set of rules for the whole country.
Exactly. It has to be comprehensive, clearly defined, and enforced across all healthcare providers.
Right, no loopholes.
None. And we have to invest in cybersecurity infrastructure.
Right, like make it a priority.
A top priority. No more putting it off. We also need to be transparent about how data is used and make sure we have explicit patient consent.
So respect for people's data and their rights.
Absolutely.
Yeah.
And just like with sanitation, we need public awareness campaigns.
Oh, yeah. So people know what's going on with their data.
Exactly. They need to know their rights. And here's where those public-private partnerships can be useful again.
Oh, right.
To bring in that specialized tech expertise to beef up data security.
It's amazing how these common themes keep popping up, isn't it?
It is.
Like whether we're talking about sanitation, training health workers, or protecting data.
Right.
It's always about national standards, consistent funding, better collaboration, investing in people and infrastructure, and educating the public.
It's all connected. And it highlights how progress in one area can really have a positive impact on the others.
Well, yeah, because if you think about it, a healthy workforce is more productive. A population that understands hygiene is less likely to get sick.
Right.
And a strong healthcare system attracts investment and innovation.
Absolutely. It's all part of the same big picture.
And if you zoom out even further, you see that progress in one area often depends on progress in the others.
Oh, yeah. You can't have one without the other.
It's like they're all pieces of the same puzzle.
They are. Take disease surveillance, for example.
Okay.
Increasingly, that relies on digital data systems.
Right.
But for that to work, the data has to be accurate, accessible, and secure. And the insights we get from that surveillance, well, that can inform how we approach sanitation and hygiene.
Right.
And it can guide the work of the community health workers.
So it's all a loop.
A big interconnected loop.
So for you, our listener, why should you care about all of this?
Well, ultimately, it comes down to the potential for a healthier India.
Okay.
If we can overcome these challenges through better collaboration and smarter policies, we could see a huge improvement in public health. Right.
Less disease, a more efficient healthcare system for everyone.
And that would have all sorts of knock-on effects, right?
Oh, yeah, absolutely. It wouldn't just be about health outcomes. It would also be about economics. Less money spent on treating preventable diseases.
Right.
A healthier workforce means more productivity, and that helps the economy grow.
Makes sense.
And a strong healthcare system can boost India's global standing.
And attract more investment.
Exactly. So it's a win-win all around.
But even beyond the economics, it's about people's lives, isn't it?
It is. You know, when communities have clean sanitation, when health workers have the support they need,
Right.
and when people's health data is secure,
Mm-hmm.
well, that creates a foundation for a better quality of life.
For millions of people.
For everyone, really. And, you know, this brings up an interesting point.
Okay.
As you're thinking about these challenges in India,
Mm-hmm.
it might be helpful to think about other complex systems you encounter.
Oh, like in our own lives. Exactly. Do you see similar patterns? You know, lack of coordination, political roadblocks.
That's a really interesting way to think about it.
Because in a lot of cases, a more collaborative approach could lead to much better results.
Regardless of the specific problem, right?
Absolutely. It's about recognizing that these seemingly separate issues are actually all connected.
Right, they're all part of a larger system.
And if we want to create real lasting change, we need to work together.
Across sectors, across political divides.
Exactly. That's how we solve these big, complex challenges.
Well, it's something to think about, isn't it?
It is. It makes you wonder how many problems could be solved if we just learned to work together more effectively.
Food for thought. Thanks for joining us for this deep dive.
My pleasure. It was a fascinating conversation.
And we hope it's given you, our listener, something to ponder as you go about your day.